Right, I'm going to open up the meeting, so thanks for joining. So welcome to today's workshop on developing your value proposition when selling to the NHS. Some of you might leave this meeting thinking, great, my value proposition is really solid and really compelling, and others might think I can strengthen it a bit. I'm going to chair the meeting today, and it's my privilege to have my colleague Laura with us. We both worked at J&J some time ago. She's going to be leading the session. What we're going to do is we've already started recording the session. We are going to mute all the delegates, not because we don't want to hear from you, but just to reduce the interruptions and background noise so dogs and cats and kids can play in the background. Any questions, just put them in the chat and I will keep an eye on them. And I'll be coming in on a couple of slides with a couple of points, but it's largely Laura's show. And we'd quite like to keep the questions at the end because we think the slides will take about 30 minutes and then we can try and build that into a discussion. So if that's all right with everybody, I'm going to pass it over to Laura.
Thanks very much, Steve, and welcome everybody. Thanks for joining us this lunchtime. It's great to see you all here. So as Steve said, I am a colleague of his. My name is Laura Boland and I'm Head of Evaluation and Insights at Health Innovation North West Coast. My background is largely commercial. I was 13 years at Johnson & Johnson in market access, launching transformational solutions and medicines before joining the NHS 6 years ago, where I've worked on both industry support and also lots of real world evaluation and insight projects, which I think is testament to the demand for great evidence to support value propositions. So hopefully I can share some of the things that I've learnt over the last 20 years with you today. So as Steve said, some of you might already have a good value proposition. Some of you may be a little bit more new to the concept of a value proposition, how to get a really robust one. But hopefully by the end of the session, you'll all have some additional learnings that will help you to really craft a very well refined value proposition. And I think even if you've got one, it's always great to take that time for reflection and think about how you could reiterate that and strengthen it and make it really robust and valuable for where you are today. Okay, so before we kind of get into the flow of what a value proposition is and how you might craft a good one, I just want you all to take a minute to have a think about your own solution that you're working on, that you want to sell into the NHS, and presumably why you're here today, and just sort of reflect and ask yourself these questions. So do you really understand about your solution? Specifically, what does that offer, and whom are you offering it to, where that fits into the existing pathway? Do you know whether you complement commonly used technologies or do you displace them? And do you understand the way that you make certain business processes get executed and how care is delivered, and really that sort of bigger picture around where your solution will fit? And the last question, I guess, to ask yourself is, do you get how that solution is going to be financed and procured? Steve, I don't know if you wanted to come in here. I think you had a couple of sort of additional thoughts to reflect on. Sorry, you're on mute, Steve.
Is that your third or fourth slide? I can't see the number. I was going to come in on number 4.
Yeah, this is yeah.
This is number 4?
Yeah.
Okay. So just wanted to see if I could bring a couple of my clients into this conversation. So Hayden, I'll give you the heads up. Leo, I'll give you the heads up. And is Simon there from Navino as well? I think he is, Simon Smith. So before I do that, so just so you know, I'm going to come to you. I'm not going to put you on the spot in any uncomfortable way. We've got a really good client of ours who's not on the call from NG Pod. And so basically, if you need to be fed into your stomach by a tube, the risk is that tube could accidentally go into your lungs and fluid or food could go in there, and that does cause pneumonia and big complications. Company did a randomized clinical trial and they didn't show a significant change in the reduction of misplacement, but what they discovered was 40% of people no longer needed to go for a chest x-ray. That saved an hour and some time. And the nurse placement of the tube, because it's automated now, there's no suction or anything like that, the nurse time from placement of the tube went from 15 minutes down to 9. So actually the value proposition changed immediately, because it wasn't just about a product that is going to be about patient safety. It was going to reduce x-rays that confirmed placement, and it was going to save nursing time. That's what really got the interest of the clinicians. So just because I can see you first, Hayden, if I can bring you in and I'll set you up on this one. Hayden's a lovely guy, started working in the last 3 months. He's got 4 products. He's a clever guy. It's taken us a while to come to the conclusion that how do we take something that's quite complicated and simplify it? Would that be fair, Hayden? I don't know if we can unmute Hayden. Phil, sorry.
You should be able to do it now, Hayden.
Try again, Hayden. Do I need to do it? No.
Oh, he should have the option to unmute himself manually.
Okay, Leo, can you see if you can unmute yourself? No.
We can come back to it at the end, Steve.
Okay.
Just maybe people sort of keep that in their minds and sort of reflect on where
so
you're
I'll
at.
come back to Hayden, and looks like Leo has managed to unmute. What do you want to do, Laura? Do you want to come back to it?
Yeah, we can come back to it. It's just
okay,
to pose that question to yourself, really. Have reflect on where you're at with that, and keep that in mind as we move through the session. Okay, shall I carry on?
Yeah.
Brilliant. Okay, so this is the agenda for today. We're going to break down and think about how you can craft the perfect value proposition. And the first thing we're going to talk about is the kind of the principles of that and what value proposition is, and why you need it. Then we're going to have a think about how you can really understand the NHS need. You might think you do, but we're going to pose some questions to sort of check that understanding, how you might evaluate your value and demonstrate what it is that you're going to bring, what your solution is going to bring to the system. And then we'll have a think about planning your value proposition and actually how you craft a perfect value proposition, including what makes a good and bad one. Okay, so we're just going to take a minute to reflect on what actually is a value proposition. So Wikipedia definition there at the top, it's that promise of a value to be delivered and acknowledged, and a belief from the customer that that value will actually be delivered and experienced. And the second one is, just in my words there, I think it's really a statement that proves that I know what they want to need, why they want to need it, and why they should believe that I will provide it to them. But essentially, your value proposition, it's got to be that credible and coherent set of claims that demonstrate the value of that product or service to health and care providers and patients. And in our experience, if you don't have one, you're going to struggle, because key decision makers in all roles, financial, clinical and operational roles, are going to need to see that robust value proposition before they commit to doing anything with your innovation. So I suppose the first thing to really think about and reflect on, I'm sure you understand this, trying to sell into the NHS, it's difficult. The NHS is a really risk-averse organisation, probably as risk-averse as it gets, with very good reason. We've got patients at the forefront of mind and do no harm. So they're kind of the epitome of loss aversion. They don't want to do anything that's going to harm those patients and drive any change. But at the same time, they need innovation. We need change in the system. So how do we, move past that sort of inertia and move beyond that sort of interesting sort of comments about your product to really get them to change action and to adopt your innovation? Well, it's all around that case for change. So you've got to really think through, what it is that the benefit, the existing challenge of the problem at the moment, and really to think how you're going to adapt your solution to that. So, what is it poor quality care? Is what they're doing presently unsafe? Is it detrimental to staff well-being? Are they missing targets? And really think through what that challenge is, and how you're going to present that case for change to move them away from inertia. Okay, so we're going to break down the value proposition session into this 4-step process, just like the value proposition itself. We want the session to be kind of simple and memorable so you can take it away. So the 4-step process is, first of all, we're going to really understand what the need in the system. Then we're going to think through how you're going to evaluate the value of your solution so you can demonstrate that. Then we'll do the construction of the value proposition, and the final step is to test, to reiterate, and to get it perfect. Okay, so understand. So the NHS, lots of opportunities. It's a huge market, but also it's a really challenging market with lots of competition for time and resources at every step. And you're really going to struggle if you don't have that sort of hyper focus when you're matching your benefits to the NHS need. You probably have your head sort of bubbling with lots of benefits that your product can offer. And like the NG Pod example that Steve's already given, not all of those are going to be of interest to the system, or certainly not high enough priority to get them to change, to get them to adopt your innovation. So it's really, the first thing you need to do is really understand that unmet need, so you can drill down and understand which of those benefits are at that overlap point in the Venn diagram, and those are those that are going to be the headline in your value proposition, and really help you to beat the competition and get your product into the system. So just some questions then to really get you thinking about whether you actually do fully understand what that problem is, and how they're going to manage it without you. So here's the 4 U's, as they're known. So questions to ask yourself sort of now and when you go away today. The first one, is the problem unworkable? So do you know whether it addresses, your innovation addresses any deficiencies in the system? What's going on at the moment, and is it that much of a priority that this kind of it's unworkable and there's nothing to be done about it? Is fixing the problem unavoidable? So is there a mandate for this, or is it something that actually that they can avoid, and you're trying to sell a benefit that is, it is avoidable, and they can just say that's nice but kind of push you to one side? Is the problem urgent? So is it a priority for them? And if so, do you really understand how that's a priority? And finally, is the problem underserved? So is there a lack of other options, or actually do you have some competition, and there's already solutions that will do in that space? And I think the sort of the key point here is that if you don't understand that problem to that depth, then without that, you just can't isolate your unique value, and really think about what it is that's going to put you ahead of the competition. Okay, so just a few more questions then to ask yourself and have a think about how you really get specific with that and understand that need behind the need. So the bigger picture problem stuff, but then understanding exactly where it is in the system that need the most pressing sort of challenges fit. Is it primary, secondary, or social care? Do you really understand what the burden is of that disease or condition, and why current practice isn't sufficient? Do you understand who's going to be prescribing, recommending, and implementing your product, as well as maybe sort of higher level decision makers and purchasers? Who's going to pay for it? And then what are those sort of high level strategic drivers, as well as the operational need? How does the problem impact the lives of patients? And what is the cost to the system of both the disease and the current standard of care? I think it's really worth going away today and reflecting on all these questions and just being sure that you can answer them. And if not, homework, I think, it's worth taking the time to do that desk research and to get to the bottom of this, so that you're not out there wasting time with a value proposition that's not going to hit the mark. So we've got some useful tools and resources that can help you do just that. So there's a whole list of links there. We'll share the slides afterwards, so you can kind of go off and have a good look at these. But the first set of links there are resources that will really help you to understand the more strategic priorities of the system. So the longer term plans for workforce and recovery and inequalities. But if you've got an innovation that you think actually it's got more of a local or regional focus, and that's going to be the way in, then absolutely it's worth having a good look at your local ICS or ICB strategies, which should all be publicly available on the internet. And then there's a raft of other information sources as well. We can also share links for these, but it's definitely worth taking your time to do that desk research and being really well prepared, so you can talk to the burden and the magnitude of the problem to build out that case for change. So on the left-hand side there, the bigger picture stuff. There's loads of good resources on NHS Digital now, so you can see all of the health episode statistics data to really understand the number of diagnosis and procedures in a specific area that you might be trying to address. There is talking therapies data. There's some brilliant public health dashboards available now where you can look at, the burden of respiratory or mental health or obesity, or there's other sort of big challenges, and try and work out your hook. And equally, Get It Right First Time as well is a good resource. That's a sort of a showcase of best practice to try and reduce variation, but you might find loads of info in there on pathways and coding, and again, some really good sort of policy hooks. Locally, not only do you have the strategic plans at ICS level, but you should be able to find annual reports, quality accounts, and increasingly now green plans and digital strategies. And I think they're really important because sustainability is absolutely going up the agenda, but also digital strategies will often set out the roadmap for prioritization, and often with these things, it's about timing and understanding what's coming on that roadmap and which of the projects that have been implemented and rolled out you can maybe augment or support, and yeah, you can really get some richness on how to engage with the digital teams from that as well. And then finally, resources like NICE will give you lots of information about the competition and other products maybe in that space. They're great at those sorts of roundup and literature reviews as part of their process as well. And then of course there's us, so come and talk to us if you want to test your thinking and your understanding of NHS need. I think Steve's going to make that offer later on in the session, but that goes for me as well. So talk to us or your local health innovation network, and also if you've got a good relationship with local sort of influencing decision-making professionals, I think don't be afraid to kind of be honest and go to them and say that before we talk about products, we really need to understand, what's going on locally, and what the real need and the real challenges are in the local system. So before we move on, just a bit of a reminder, really. I think we can all sort of get heads down and get sort of carried away thinking about the benefits and the features of our projects. But, ultimately, it's a good reminder to remember that, the NHS and central government, what we're doing here is we're trying to provide good care. So ultimately, they're interested in that provision of better care and improved health outcomes. Yes, value is important, and being able to talk to efficiency and cost effectiveness is important, but you always sort of need to bring that back to what that means for the patient. What does that mean for staff caring for the patient, and what does that mean for patient outcomes? So that should really be upfront in your value proposition. I'm not going to dwell on this. I just wanted to flag. So those of you that have not heard of this before, there is a tool, an online tool called the Value Proposition Canvas, which if you're quite new to crafting your value proposition is probably worth a look. It walks you through the process of really thinking about what those gain creators and pain relievers are. So, the need and the benefits for the system. It's nice and visual. So, it's really easy to find on the internet, and if you're going away thinking I've got a ton of questions and I don't know where to start, that can be quite a nice process to follow through. But it's probably a session for another workshop, so I'll just flag it and leave it there. Okay, so you've done your desk research, you really understand the need, you think you've got it down, and now you can make some really good claims about how your solution and the benefits that it brings are going to help address that need. Great, but now you've got to think about how you're going to evidence that if you haven't already. It's obviously essential that any claims about improving care and health outcomes have the evidence to back it up. So there's lots of ways to evaluate products. But what you really need to do is bring that back to thinking about your unique unique value of your solution. So first of all, you've got to think about what is that USP and find out if your breakthrough product is actually unique and compelling, and what is it that what's that thing that it's offering that's transformative benefits over the status quo, and what is it that makes it sort of unique? Is it more cost effective compared to the alternative, or what sort of measurable value does it deliver? So at some point you are really going to have to think about demonstrating the cost effectiveness of the product, and weighing up health outcomes versus cost. So, any cost effectiveness analysis that you're thinking of doing, again, it should always relate back to that core value proposition. Ask yourself, what is the need? Which outcomes can you deliver to address that need? And how much is it going to cost? And this one here is just a bit of a reminder around what the service is looking for with that. So yes, we're looking for value, and that definition of value is outcomes over resources. So just some suggestions there of the things that you might want to start evidencing to prove the value of your solution. So it could be things like care outcomes, population health, survival rate, etc. And patient experience is equally important. Think about the patient safety benefits of the products. And then in terms of resources, it could be both revenue costs, things like income and salaries, and also think through what the implications are for capital costs as well, the upfront investment for implementation in infrastructure and equipment. Okay, so once you've got all your sort of supporting evidence, one thing that we see quite often is people are understandably proud of that, and we'll try and sort of throw all that at the system in sort of a dossier, and I think you sort of need to rethink it with the value proposition. Have a think of, visualize your different data as kind of the core pillars that underpin your value proposition, but don't try and tell your audience too much in those early interactions. It should be really clear. And as we said already, the value should always relate back to their needs. So have that clarity of thought with your value proposition. Great to have all of your evidence to back it up, but don't try and sort of put a 5,000 word document in front of the system. Have that clarity around the messaging and use the supporting evidence to back it up. And the other thing I just wanted to sort of highlight before we move on out of the evaluation section is this sort of gain to pain ratio. So we've discussed the fact that the NHS is really risk averse. You need a compelling case for change to move them away from that nice sort of inertia. For disruptive innovation, unfortunately, it's actually even more difficult to drive them beyond that inertia risk because of the perceived risk and because of the extra effort that goes into the pathway change and the necessary change that comes with disruptive innovation. So not only do small businesses with a disruptive innovation have to offer that sort of higher pain to gain ratio, you've got to think about how you can really strengthen the case for change to make them do that. So just one thing to think about with that is don't just evidence your gains, don't just evidence the benefits of your product. Have a think about whether the evidence around the pain, so the need in the system, is sufficient, and really focus on that. If it's not, maybe you can add to the evidence base, or maybe it's just around sort of pulling that together and harnessing that so you've got that really compelling story. Okay, and so this slide is taken from some research by a lady called Tricia Greenhill, who's a professor down in Oxford, and she's done a lot of research into this area and how we can boost innovation adoption, particularly for new innovation that is disruptive. And she's suggested these other attributes that you might want to consider evidencing and talking to in your value proposition to really help you move people away from inertia. So the top one is the obvious one that everybody does. So that's that relative advantage. It's the efficacy, it's the benefit of your product. but it's definitely worth thinking about talking to some of these other points. You know, if you have a product that's easy to use, you know, users like it, then talk to that. If it's, you know, compatible with what they've got, interoperable, absolutely, you should talk to that as well. The same about, so what we mean here by sort of observability and trialability is, can they see the impact? Can they try it safely and have a go? So this probably applies more to sort of digital health technology than certainly not to medicines. You wouldn't want that. But if you've got a product that you can kind of drop in and have a go, then I think you absolutely highlight that as well. And the same for potential for customization and ease of use. So yeah, just some other things to think about, potentially evidencing once you've got that relative advantage argument nailed. Okay, so you understand the need and you've built up your evidence base. Now you're ready to actually construct your value proposition. So how do we go about that? So just a few sort of cautionary tales to start with. The other thing we see quite a lot with value propositions is people thinking they're just sort of a mission statement. It's a visionary thing, and you know, this is where we want to get to, and this is where we're going to go. They can sometimes just be a list of product features which completely ignore, completely fail to display an understanding of the real challenges in the system. Not just catchy slogans, you can put them in if you want to, but you know, it's beyond sort of marketing messages. And we've already talked about, don't just make it a data dump and throw it all in there. And don't be afraid to keep it simple. It's really important that your value proposition lands. You know, the system has never been busier and short on time. It can be really hard to get in front of your audience, and when you do, you need to maximize that opportunity. So it's got to be understandable at first hearing, really. So keep it simple and tailor it as well. So make sure your value proposition is going to land with the person in front of you. So if it's a financial audience, tailor it for that audience. Similarly for an operational or clinical audience. So it might be actually that you have 2, 3 slightly tweaked value propositions that reflect that. You know, you're still talking to the same need, and you're still talking to the same benefits of your solution, but just maybe the language and the prioritization of the way that you describe how you're going to solve that problem just might need to shift slightly as well, to ensure you're maximizing that opportunity. Okay, so this is the structure and the framework that we would always recommend to businesses when constructing the value proposition. So start with the issue. You know, what is that problem? Why is it risky not to change? And then only then you can start to talk about your solution and match your innovation's key benefits to that problem. And then finally, it's that evidence. So talk to the impact. What are those gains over the product or service alternatives and the overall value? And what are those other things? You know, is it usable, user friendly? Is it easy to integrate, etc.? Then you can start to talk about those broader impacts as well. And then I think it's nearly my last slide. We're getting there. So before we open it up for a bit of discussion, just sort of final cautionary tale. These are a bit of a list of fatal flaws that we see. So again, take this away, have a think about it, make sure you're not falling into the trap of any of these where, you know, the problem that you think is a problem hasn't been validated and it's not the real problem, and the benefit you think you're offering isn't actually going to deliver real patient or system benefit. Right person, wrong message, tailor it, make sure it's right for your audience. Don't make any claims you can't evidence. You might think that your product can do something, but you need to demonstrate that first before you go in making claims, because they will find you out. Too much emphasis on the minor details. Make sure your messaging is right and you're prioritizing properly. Don't get creative with the numbers or blind them with too much science, and absolutely keep it simple and keep it succinct. Okay, so once you've constructed it, then the next and final stage is test. So you should see this as a live process, your value proposition. You should reiterate it, reflect on it, revisit it as you go throughout the year. Make sure it is, it's current and it's reflecting your best understanding of the value that you bring to the system. Yeah, so we're going to open it up for a discussion in a minute. So before we do, just to say that the value proposition it's kind of your whole business strategy, really. It's sort of your guiding principle for the work that you do and the way that you engage with the system. So, spend time on it, be guided by it, ensure that you can always sort of articulate it clearly. And then the final point really is just to recognise the constraints of the system in which the innovation is to be introduced, and that implementation challenge as well. So that will really help you to understand when your value proposition is landing, whether you've got it right. And when you do recognise that you have, then sort of hold on to that and deliver it with confidence. So Steve, that's it from me. Are we going to have a...
Yep, if you hand it back to me,
yes.
So Laura mentioned the word clarity a few times in her presentation, so I'm sure you'll agree with me that she has presented just now with great clarity. So why is clarity important? Probably because there's so much noise, but actually if there's clarity, people have a very good chance of comprehending what you're telling them. And if they comprehend it, they've got a stronger chance of believing your solution can help them. And I think the other thing is once you've got to that point, that's when you can start working on the compelling, persuasive stuff. I always encourage my clients, and half of you on this call are my clients, to ask themselves, how does your product improve care, services, and outcomes for patients and staff? So once your value proposition is presented and your product is bought, it's down to the nurse or the patient or the porter to be able to describe the difference and improvement it makes for them. And I keep it really simple. When at the Boston Scientific, we were not allowed to launch a new product unless we could prove to ourselves it was easier, faster, safer, or cheaper for the cardiologist to use that new product. So just in that quick little summary there, I didn't know if Lior or Hayden or Simon and Jim from Linus, if you feel comfortable, I bring you into a discussion to get the chat started. Let's see if we can do the unmuting bit. Is yours unmuted, Hayden? No. Who's unmuted? Lior, can I start with you? Yep. So Lior is from quite a decent sized company called Zoll. I'll just set the scene and he can take over. So basically, his product, it helps clinicians do a test for something called sleep apnea, which has enormous lifestyle implications for the individual, the family, whoever you work for, and the system. And I didn't realize until I met Lior that 40% of people who get referred by a GP for a test don't need that bloody test. That's a waste of resource. Then we've got 1 million people with sleep apnea that never come to the GP or never get found or never get diagnosed. So he's trying to change a big problem. And the advantage he's got is they are a trusted customer in secondary care, which is where the test currently is prescribed, right? His ambition is to get GPs to prescribe this point of care test for patients. They don't go to hospital in the first place. Now, that's a real big game changer. So I don't know, Lior, if you just want to take a minute to come in on top of that.
Yeah, I think you've described it very nicely. Top level numbers, 1 billion sleep apnea sufferers worldwide. So it's that big. And we only managed to deal with maybe 20% of those, probably less. This is a global problem. Numbers are similar in the UK. The reason is, first of all, lack of awareness, but also lack of accessibility. So we're not being proactive here. We're not approaching patients to get tested. So unless the patient will present themselves to the GP, they will never get tested and obviously never treated. Now the problem is big because sleep apnea leads to nasty diseases, cardiovascular disease, type 2 diabetes, many other problems. It's strongly linked, and treating those diseases is of course highly expensive. This can all hopefully be prevented if the patients will be treated for the sleep apnea condition, which is entirely manageable and cost effective. But it all starts with a simple diagnosis that can actually be done from the GP practice or even from the patient's own home. The patient doesn't really need to leave home to get screened and fully diagnosed. The technology is there. It's quite simple to be used both for the patient and for the GP. In fact, it can be practically managed by the healthcare assistant. It doesn't have to be the GPs themselves. What is important is that the test results will be looked at by a sleep specialist at the hospital. And again, we have the digital solution to support that. So really, we can keep everyone happy. Patient, GP, the specialist at the hospital, they can all collaborate in a seamless fashion using this digital solution. Of course, what is difficult is to manage to introduce this kind of a game changer to the system, because it has to do with a change of pathway, with changing the way that reimbursement currently works. So these are not small feats.
So Lior didn't know I was going to ask him to do that. He clearly knows his he clearly knows his problem. He clearly knows his market. He could have probably done that in a shorter period of time, but I think most of you probably, even if you're not clinicians, have a better understanding in the first 2 minutes that I gave you, right? So that's the first thing. And I will come to you if you could just hold your hand for a second. Simon, did you manage to unmute from Navinio? No. Okay.
Yeah, I did.
Oh, Hayden, good
I'm
man.
in.
Okay.
I'm in.
I've already said what I said before. I think when we first met, I was like, you're going to have to simplify this for me, because you're asking me to present 4 different solutions to 4 different clinical groups.
Yeah.
And I'm not a subject expert in those things. And he's been very receptive to, okay, Steve, I can turn 300 words into 30 words for you. Can you comment on that?
Yeah, good old ChatGPT. No, I'm only joking. It does help though. There is a really good generative AI value proposition tool that's well worth Googling and having a go with, and we've had a little play around with that, and it's actually been very effective. So just get to that stage. But I've got a couple of stories for you. One of the I'm just going to talk about 2 of the innovations today. So one of those innovations is Venturi, which is a clinical avatar technology we spent the last 6-7 years developing. And when we set out about solving the problem of scaling information in lots of different languages representing different ethnicities, Core 20 wasn't a thing. We just saw all the headlines in the Daily Mail were all around the lack of GPs available. So we thought, well, let's just tackle. We're just going to go hell for leather on tackling primary care and minor ailments, okay? Because there was a massive issue around that. But obviously, Core 20's come in since, and we align absolutely perfectly to it. So it's a bit of luck, but we've had to reshape our value proposition accordingly to that. So that's the first thing. Another innovation we have, which is called MySpira, which is an application aimed at primary school kids, which trains them using augmented reality. So it's an app on a mobile device, trains them how to manage or teaches them what asthma is and how to manage it. So it's very gamified, if you like. Now, what we found is that our best friend in that regard, it's always a tricky sell, because it's like, just shiny new type stuff and no one really gets it. But we invested in an economic analysis with one of the HINs who kindly found a grant for us to do that. And that really helped, because straight away we could say, we can reduce SABA use by 2/3 and, CO2. So we're aligning to all the problems that we're being told by the HIN that we have to do. So the HINs have been almost our best friend to a degree, just to give us that insight in order to how to address the problems, which we've done visually. And again, that's another point to say is actually what Steve just said about about clarity. Talking about the stuff is, if you remember, 70% of us are visual people. If you can show it in a funky flowchart or some diagrams of exactly what impact you're going to have, people get it much more than just a load of text.
So just to build on that point, then Indy's next. I was interviewing a new client yesterday. There was 4 people from Vietnam, 1 dialed in from Manchester. The language was a little bit of an issue, but they put up this diagram on slide 3, and it said number 1, 2, 3, 4, 5, 6, 7, 8. That's exactly what happened, Steve. And I was like, oh, I get it. And that was really a massive connection for us. Indy, can I bring you in if you still want to comment at all?
It's a suggestion, Steve. So, Leo, putting you on the spot here a little bit. You said quite a lot in terms of your value proposition, and I'm just wondering, depending on whether we've got time, whether we just work with Leo just to kind of articulate that into a very clarified, succinct value proposition.
We're going to do that offline, Indy. That's going to be the homework.
Okay.
Yep, we're going to do that for anyone who wants that offline. But thank you. Simon, did you manage to unmute? No. Okay. Jim? Molinas? No?
Yep.
Oh, there he is. Let me set the same for you. So, very good client of mine. He's got a product that's going to digitalize heart failure. Well, it already is actually. Heart failure and COPD. So it's a cardiovascular and respiratory pathway. And of course, the question is, how does this help patients in the system? So there you go, Jim. I've set you up.
There you go. Perfect. This is good trial, because I've got to do a presentation to a couple hundred people next week, and I've got to pitch our value proposition in 3 minutes. So I better test it, run it for you. So yeah, we obviously focus long-term conditions, and we're looking at end-to-end pathways. And as you said, for us, it's about that patient impact and how we can evidence the impact on the patient. So one of our products is focused on something called digital supported self-management, and we're basically targeting COPD patients, lots of interactions with healthcare workers. Now, if you can optimize those patients, they don't use hospital resources, they've got good outcomes, etc. But due to challenges, fragmented care, not enough resource and too much demand, these patients aren't often optimized. And as a result, admissions are really high in COPD. So 1 out of 8 of all admissions in the UK is a COPD related admission. That's about 130,000, I think, last year alone. It costs a lot of money. And every time a patient has an admission, their outcomes are much worse. So we've developed a digital supported self-management solution. Basically, that includes daily patient-reported outcomes and a symptom diary, supporting the patient to understand their condition much, much better. A traffic light system in terms of what to do if they're feeling they're going to decline, medication management, and then educational content, rehabilitation, etc., coupled with remote monitoring, and then most importantly, a support network, so direct access via messaging to clinical support if they have a concern. And in COPD, actually, anxiety is one of the key drivers for exacerbations. So we've developed this service model, but for us, it was all about evidence. So we've completed a clinical study. In fact, 2 now were funded and supported by the Health Innovation Network, and we've it's gone out on socials today, actually, just published our results, which was a 50% reduction in emergency hospital admissions and attendances. And we've also evidenced £1,750 more cost effective than standard care. So more effective and more cost effective than standard care. And so we've got all that evidence together now, and that is building in on that value proposition to say, actually, the patients like the service, they can use the service, but actually the resource use from a healthcare perspective is really low. So it's not high intensity from the healthcare user's perspective, because it is really about empowering that patient to look after themselves and seek support when they need it, rather than the onus being on the healthcare worker. I'll stop there.
Jim, did you know I was going to ask you to do that?
Nope.
No. So if you ask me anything about New Zealand, where I'm from, I can probably answer 90 questions about New Zealand, right? If you ask me anything about my kids, I can probably answer 90 questions about them because they don't tell me the other 10 things. If you ask me about Vietnam, all I can tell you is I'd love to go there. I've not been there, right? So what you got from Jim there was he really understands his market, the language, the impacts. He's got the evidence. Jim, you don't have a clinical background, do you?
No, I've only been doing this for 3 years.
Yeah, but you don't need you don't need to speak Vietnamese to go to Vietnam. I guess what I'm saying is you've just watched Jim unprompted do a pretty polished pitch. So well done. I don't know, Simon, and I'm going to open up to anyone else who'd like a practice. I've tried to unmute you, Simon. I think it's worked. So try again. Yeah, there you go. Can I set the thing for you? Yeah, it'll give you time to think. So Simon and I have only just started working together in the last 2 months or so. Got a really high potential product, which is about task delegation and prioritization of tools. And my challenge to him was, after probably a 15-minute presentation, we both worked at Boston Scientific and J&J, is think about in a year's time of if a system's bought your product, how would the nurse, the porter, or the pharmacist, or the radiologist describe how it helps them? And if I said I'm taking it off them, why would they fight me to keep it?
Yeah, thanks, Steve. Yeah, so in a nutshell, I think, first of all, thanks for the presentation, guys. I think it was fantastic. Also, thanks, Steve, for the support you've given us so far. It's been really, really useful. As a product, I think one of the most interesting things that you said there, Laura, was the NHS is a risk-averse organisation, and they need to feel it's riskier to maintain the status quo than to make a change. I thought that was a really, really interesting statement that you made there, and it just made me think a bit about our technology and if it really is disruptive or not. I think it's more of a step change innovation. So what Navenio bring is step change technology, patented, infrastructure free tasking and asset location services all built into a smartphone, so avoiding the need for infrastructure within the hospital environment, so moving away from the BT, the Cisco's, etc. Everything is delivered via the handset. I think the key thing that we've worked on with Steve is building that value proposition. I think there's more work to do. I think that we've made some really good inroads into that so far, but what we've been able to identify is what is the problem that we're trying to address. Well, the problem that we're trying to address is nurses wasting time searching for devices, for example, no information on when a bed is vacated and therefore when a bed needs to be cleaned. So in essence, we're supporting patient flow, we're supporting the need for the care continuum to see more patients in a day. And what we're able to do from that is able to very quickly source any device within the hospital environment. So, for example, an infusion pump or any small device that may be located close to the ward, but not close enough for the nurses to actually find it quickly. So, what we're able to do is find that device to within a few meters. So that's one part of what we do. The second part of what we do is also about tasking, and it's also trigger tasking too. So in essence, when a bed needs a clean, what we're able to do is automate that process and work in conjunction with existing systems within the hospital environment, for example, EPR systems, nurse call systems, etc. So really what we're about is sitting as a supportive technology to help drive efficiency and productivity, working in cohesion with existing systems and processes and workflows within the NHS. So what we've managed to do as a final piece on that is to build the health economic outcomes, which basically says that we are able to save significantly on nurse agency spend. We're able to drive revenue for additional throughput in radiology, for example. So the trust is therefore able to deliver more scans in a day, or we're able to support that nurse time in finding assets quickly and therefore taking back the time that nurses need back to the bedside. So lots of pieces there that we've kind of brought together. We've got a few more bits that we need to fill from a value and health economic point of view, but certainly we're in the final throes of building that out now.
Thanks, Simon. Can I check? I think my colleague Kevin is still on the call. He looks after international clients. Just wanted to give him the opportunity. Is there anything that we've missed or you'd like to add or emphasize, Kevin?
No, I don't think so. I think the point I'd just like to emphasize that Laura made is that, you know, this should be an ongoing process. That's something that we learn with the companies that we support, is that when we have conversations with clinicians, you'll often learn new things. And so that value proposition statement needs to be constantly updated to reflect those that intelligence that you're gathering. So don't think of it as something that's really static. Use the intelligence that you gather in those sessions to feed into it and develop it. And I think one of your participants was saying about some of the legislation and some of the policy drivers that came into place that aligned nicely with your technology. I think the more you can find out about those sort of things, any sort of policy drivers that really sort of endorse and push your technology are really going to speak the language of the NHS. So I would encourage you to look for them as much as possible.
Yeah, that's a really good point, the ongoing one. Thanks for that, Kevin. I think there is a question from Suzanne that probably Indy, myself, and Kevin and Laura can take between us on sustainability. So I think it's an issue for society and all industries, and the NHS has woken up to it as well. I mean, I think we contribute something like 4% of emissions in the UK from the NHS itself, you know, whether that's power consumption or transport and stuff. I think that's right, isn't it? It's 4%. If someone could correct me. So, Susan, do you want to come on and just expand on your question? Because I don't want to answer it from the wrong angle otherwise. Suzanne Ackley, comfortable coming on?
Yeah, yep, I'm here. Hi.
Hello there.
Hi, nice to meet you. Yeah, I'm particularly looking at the angle of the sustainment or sustainability of the product or the innovation that's going in. So, you know, we talk about getting in the door or getting it within the NHS, but to then be long-term commissioned and commissioned over time is a different proposition. And I just wondered, you know, how much of a focus that needs to have in a initial value proposition.
And are you in stroke care, is that right?
That's right, yeah. Hi.
Are you thinking of a particular problem you're facing or thinking of trying to solve?
So I'm a clinical academic embedded within sort of the NHS. So we have developed a neurorehabilitation online, so a tele-rehabilitation. It's in a sort of hybrid approach to delivering rehabilitation, and it is sort of ongoing within the NHS at the moment. And it's, I guess, about that continued proof of concepts there. It's been scaled up, but it's I guess that ongoing next stage, the continued value proposition, I guess it is, to continue implementation and sustainment over a period of time.
Two things. Please reach out to me after this call and we can build on the help we might be to give you over and above the net green bit. Can I bring in Kevin?
Yeah, Suzanne, I've only got obviously a very high level view of what you've just described as what your offer is, but I'm guessing that you potentially reduce patients having to come in for appointments. Yeah.
It's more the opposite. It's community based, so it's more reducing staff need to travel to patients, but
okay.
Yeah.
So I mean that's I think that's the obvious one that you could potentially pin this on. You know, it's not just about whether patients are having to travel to dispersed locations to undergo their rehabilitation. It's also about where the staff have to go to do that. So I think that's one obvious thing in the sustainability agenda that you could pin this on. I think I probably need to know a little bit more about your technology before I could offer any more, but that's the immediate one that springs to mind.
Thank you.
Yeah, Laura, just buy me some time. I'm just putting my
Yeah,
email
no,
in
I'm
there
just
saying,
going to echo Kevin's comments really, saying depending on what it is and where it fits in the system depends on how high up the prioritization list or high up in the priorities that sustainability is. So I think in your situation is probably not the number one priority. Absolutely talk to it, but that cost effectiveness and the workforce impact is probably a more of a core message for your value proposition.
Yeah,
And
I
that's where
guess
we're
I
at.
am interested in its place in value propositions per se, regardless of the project or the innovation, how much of a focus should it be? We talked about the evaluation, but we didn't talk about ongoing evaluation. And I guess it's those longer term things.
Why it's useful to look at the green plans and local strategies, because there is that variation, and in some places it will be it'll be a ticket item and it'll be a priority and it's worth mentioning, and unfortunately in other places it's just not yet. So
Suzanne, we can pick that up, but I'm going to give Kevin the last rights before, and not the religious one, obviously, before I just quickly summarise.
Yeah, no, I think it's worth saying, Suzanne, that, and I'm not sure whether Laura covered this, but often your value proposition, you need to think about who the audience is, and it may well be a need that may well be a requirement for you to have various different versions of your value proposition depending on who it is that you're talking to. So if it is somebody within procurement, within commissioning, who's got that sustainability hat on, then maybe this needs to come a bit further up the agenda in terms of your value proposition statement. But yeah, I think the one thing I wanted to add there is just be mindful of the audience and when you're positioning the benefits. And
I would say we need at least 3 really. Obviously there's consistencies and overlap with your key messages, but tweak them for that more sort of commissioning, financial audience, a clinical audience, and a more operational audience, and that should stand you in good stead.
So I love it when a colleague does something unprompted, which you've just managed to do for me, Kim, which was use the word proposition or positioning. So we talked about value proposition, right? That's how a customer describes your product to another customer. Right. I'm going to leave you with this thought. An airbag and a helmet and a seatbelt are all protection devices designed to reduce injury and death. Airbags are in cars, but they're not on bikes. Seatbelts are in cars, but they're not on bikes. And then helmets are only in cars in Formula One. So they're all designed to reduce injury and death, right? But they're used in different ways in different settings. So your value proposition also has to be matched to how you position it from a clinical setting point of view. How you talk to a secondary care team versus a clinical team in the community like Suzanne's just described is different. Now, I've put my email in there. I just want to say thank you to Laura once again. Phil in the background for helping run the show and keeping it slick. Apologies for the mute thing that happened. I don't know what went wrong there. We're a minute to go. You've got my email. If any of you want to have a practice, I know Kevin, myself, Andy, and Laura will be more than happy to let you do that offline. I'll leave it with you to reach out and say, yes, please, can I practice my 3-minute pitch with you? And I think, Phil, we can say goodbye to everybody, and thank you for joining us.